Well, this is one of my favorite topics is to talk about mental health, and I like to draw the comparison with health in general. Is just like any organ of your body, you can develop some sort of illness or disorder that's going to potentially temporarily or maybe become a chronic health condition. Likewise, mental health is focused on the brain because the brain is typically what drives our mental health. So, just like any organ in our body, we can either have a temporary condition that's going to maybe impair our functioning, uh, change the way we view the world for a while, uh, or it can be we can develop a chronic lifelong condition that we're going to need to manage with our brain. So we often refer to that as mental illness. Um, Sometimes when we talk about mental health, what we're talking about is wellness strategies to try to um, surround ourselves with the things and the practices that are going to try to help keep us healthy. That are just good practices to help us manage our daily living, um, and hopefully avoid some of the life circumstances that might contribute to challenging our mental health.
How prevalent is mental
Mental illness is fairly common. The estimate that we use is about 1 in 5 people living in the United States is living with a mental illness. About 1 in 25 people in this country are living with a severe and persistent mental illness, which is pretty much a chronic, lifelong condition that they're going to have to manage. At this point, there is no cure for mental illness.
For example, what were some of the illnesses?
Some of the chronic, lifelong illnesses tend to be lifelong illnesses are things like schizophrenia, bipolar disorder, major depressive disorder, obsessive compulsive disorder. These are all very treatable illnesses. There's good medication options now. We've seen a lot of improvements with that. We've learned a lot about lifestyle changes that we can make that will help support recovery to where people can live in a state of recovery and become very productive members of our community and be able to enjoy what many of us get to enjoy every day by following some principles of recovery and working with physicians and maybe going to therapy of some sort to learn strategies of how to cope with their illness.